bones of the arm and the elbow, we have the humerus bone that comes down. That's the upper arm bone up here. And you can feel the edges of the humerus on the inside of the elbow, so right in this area here, and on the outside too, so you can kind of see the edge of that bone there, the humerus. From the elbow then, we have on the pinky side of the elbow, the bone that comes down is the ulna, and on the thumb side we have the radius, and it runs down this way. So those are the two bones that make up the forearm. The bone, the actual elbow, what we think of as the elbow, the olecranon process, that's part of the ulna as it comes around. Muscles at the elbow, we have the biceps that comes down. If we have Patty flex just a little bit, you can see the outline of that muscle, and it attaches on the forearm. And then we have two other muscles that come down, the brachioradialis and the brachialis, that they help to bend the elbow up and produce that motion. On the distal side, away from the elbow, we have the forearm extensors, and if we have Patty extend her forearm here, you can see some of those muscles pop out. And then on the inside, we have the flexors, and if she flexes here, you can see these muscles that run right through here. These are very commonly associated with tennis elbow or Little League elbow. Little League elbow being more for the flexors, and where they attach right in here on the humerus, that medial epicondyle. The tennis elbow more for the extensors as they come up this way and attach on the lateral epicondyle out here, and it's just an irritation of those tendons coming off for those muscles. The ligaments of the elbow, there's the medial ligaments and the ulnar collateral ligament, and if you bend the elbow back and forth, you can kind of find and see where that joint space is, where the hinge of that elbow is, and that's where you're going to be sore, is right in this area here, because that's where the ulnar collateral ligament is. The lateral collateral ligament is in the same spot on the outside, or the lateral side of the elbow. And then the other ligament that's of note is the annular ligament, which it surrounds the radial head. And it's a little bit harder to get to. You have to kind of dig down deep inside the extensor bundle to get to that, but it's going to be kind of on the top of the elbow there. One other thing that is of interest in the elbow is if you find this medial epicondyle of the humerus, you'll notice behind it is kind of a little ridge, and if you poke on that area there, you can kind of get some tingling sensations that run through the forearm, and that's actually where the ulnar nerve runs, and it runs right back behind that epicondyle. You know, when you hit the end of your elbow and you get that kind of funny bone feeling, that's actually what you're doing, is creating a irritation of that ulnar nerve right through there.